Thank you all for joining us for today's HTRC Education Series topic, focus on addressing rural healthcare challenges through telementoring programs. Just a few notes for you all. The session is being recorded and we will share it with you afterwards. Your microphones have been muted, so please use the chat to ask questions as we tend to have a large group during the session. And then if you would like a completion certificate, please contact us at htrc@kumc.edu. Please be sure that you include your full name as you'd like it to appear on the certificate as well. And then we do have a lot of information to share today, so questions are going to be monitored in the chat and saved for the end of the presentation. All of the questions will be documented and shared in our follow-up email if we don't get a chance to have them answered during the webinar. So we will go ahead and get started. I'd like to introduce our speakers. Suyen Schneegens, Laura Potter, and Tricia Malhado. So I'll start with Suyen. Suyen serves as the Senior Program Manager, Telementoring Training and Technical Assistance for the Center for Health Policy at the University of North Texas Health Science Center at Fort Worth. For the Rural Telementoring Training Center, she serves as the Training and Technical Assistance Lead, facilitating the design, implementation, and evaluation of Learning Partners telementoring programs. She has an MA from the University of Texas at San Antonio in bicultural bilingual studies with a concentration in cultural studies, and is a graduate of the University of the Incarnate Word with a BA in Spanish, literature, and language, and a minor in psychology. Ms. Schneegens has worked on various social science projects pertaining to substance use disorders, community health, provider education, and screening, brief intervention, and referral to treatment. Next up is Laura Potter. Laura collaborates closely with RTT staff to design and implement training and technical assistance plans for learning partners, ensuring that they receive the necessary support and resources to successfully run their telementoring programs. She began her career in clinical counseling, specializing in telephonic support, and serving as a crisis counselor during natural and human-made disasters nationwide. With over 15 years of experience, Laura has expertise in mental health, training, health communication, grants administration, and community engagement. As a licensed clinical social worker, Laura earned her master's in social work with a healthcare concentration from Indiana University. And finally is Tricia Malhado. Tricia leads evaluation efforts across the Center for Health Policy at the University of North Texas Health Science Center at Fort Worth and the Rural Telementoring Training Center, including the development of the Telementoring Quality Measure Toolkit and dissemination of program findings. As a senior research specialist, she provides research guidance to faculty and residents on all aspects of the research process, with an emphasis on study methodology and statistical analysis. She's collaborated with teams across institutions to implement multi-year grant-funded projects from the state and federal grantors, including Cancer Prevention and Research Institute of Texas, the National Institute on Aging, National Institutes of Health, National Cancer Institute, Department of Defense, and the Health Resources and Services Administration. So we're very excited to have Suyen, Laura, and Tricia here with us today. So I will go ahead and turn it over to them to get started.
Great. So thank you, everyone. As Haley mentioned, my name is Suyen Schneegens, and I'm the Training and Technical Assistance Lead for the RTTC. And Laura and Tricia and I are happy to be here with you all this afternoon to share a bit about the RTTC and our services, and hopefully discuss collaboration opportunities as well. So to begin, let's take a look at the definition for telementoring, as there are a lot of tele words out there. So telementoring, also known as technology-enabled mentorship, uses telecommunication technology to educate and teach healthcare workers. But one thing to note is that it includes a mentorship component, and it can be used as a mechanism to share best practices to increase the capacity of our rural healthcare workforce. And when I say healthcare worker, we use that term very broadly. So it could include a community health worker, a primary care physician, or a nurse practitioner, to name a few. And well, how can it be utilized? It actually can be used in various ways. Unfortunately, we all are aware of the challenges that our rural communities face, for instance, with workforce recruitment and retention. And well, telementoring can actually help with this because it could be used as a model that provides ongoing mentorship and support that not only helps providers increase their knowledge and confidence, but also helps with reducing that feeling of isolation. An example is when we launched the RTTC back in 2020, we hosted a panel discussion that featured individuals who had utilized telementoring. And on our panel, we had a panelist who was a physician from an urban hospital who provided mentorship to a nurse practitioner in a rural community. And at the end of that presentation, the nurse shared that she would not have remained in her role if it wasn't for the support that she received via telementoring. And while another challenge that we see in rural communities is the lack of access to specialty care. Unfortunately, many folks in rural areas have to drive for miles or hours to even get to a specialist. And sometimes these individuals are living with a condition that could be treated by their primary care physician, who in turn could have received mentorship and support by utilizing telementoring. So why the need of a national rural telementoring training center? Well, as I mentioned, rural populations have high need of services for chronic health conditions, but unfortunately have limited access. Another being that new and promising strategies for remotely training and supporting our rural healthcare workforce lack a solid evidence base or common data elements for measuring the quality of these programs. In addition, policymakers require strong evidence on standardized quality measures to inform systemic transformations in rural health policy. And then lastly, providing tailored training and technical assistance support for telementoring implementation across multiple telementoring models, which Laura will speak on in a few minutes, supports the replicability and sustainability of these telementoring programs. And with this, I will now pass it to Laura to speak on our telementoring models.
Thanks, Suyan. Sorry, I was looking for that unmute button. As Suyan mentioned, we do focus on a variety of training and technical assistance. And so at this point in time, there are 6 different telementoring models. I don't know if we want to move to the next slide. I think that might help folks. Yes, perfect. Okay, so here's a visual picture of the 6 telementoring models that we currently offer. We're looking to add 2 more in the near future, but at the moment we have one-on-one consultation, ECHO or Project ECHO is the more formal name, adapted community health clubs, webinars, online modules and curricula, and podcasts. And so I'm going to go ahead today and take you through a deeper dive of each of the 6 telementoring models, and then also just touch on some learning partners. So these are folks that we work with that have reached out for assistance with either starting or strengthening a telementoring model. And so we'll not only look at the definitions, but then look at how it's been used out in the real world, so to speak. All right, so moving on. The first model we're going to touch on today is one-on-one consultation. And the definition, the way RTTC defines one-on-one consultation, is a one-on-one phone or video consultation between specialists and healthcare workers. And so the goal of this model is to connect a person with that subject matter expertise to someone out in the field that's working to expand their knowledge base. Because of course, if it was a subject matter expert to subject matter expert, you wouldn't need that connection. And so here it's really trying to drive on that knowledge spread out into a rural community to help address a healthcare gap. And so the first learning partner we're going to look at today comes from a group in South Texas that focused on screening, treating, and preventing hepatitis C and hepatocellular carcinoma. And their initiative was called Stop HCV, HCC. And you can see a little visual of their icon and some of the areas that they were working in the state of Texas in terms of their footprint. So we're going to take a little bit of a deeper dive. So moving on, the Stop HCV, HCC was designed to address the burden of HCV and HCC in South Texas and the high rates of uninsurance that prevent communities from accessing life-saving HCV treatment. And so for this RTTC learning partner, the RTTC helped with creating an ad hoc consultation structure between hepatologists and an academic medical center and local providers to help staff cases and discuss treatment. You're looking at a little bit of like their workflow when it came to this process. I'm sorry, it's small, but you can kind of get a feel for what we help them develop. The RTTC worked with this group to not only create that workflow, but create structured case forms and protocols to help folks out in the rural communities with disease staging, help them understand how to access pharmaceutical resources, how to provide treatment follow-up. And the local providers in the rural areas would request assistance using the forms created that we worked on with the local hepatologists. And then they would set up this one-on-one consultation. And so the subject matter expert would meet with the local provider and they would answer questions, walk them through this process, staff cases if needed, go through protocols, and then discuss next steps. So they were doing a lot of hand-holding to make sure that provider on the field felt really comfortable with what they would need to be doing to assist the clients that they were working with. And so in turn, local providers were actually able to effectively provide care and treat patients in their local communities that were living with HTV and HTC. Alrighty, so the next one we're going to look at, our second telementoring model is ECHO. And ECHO stands for Extensions for Community Healthcare Outcomes. And this is a hub and spoke model. The definition is ECHO uses video conferencing to share best practices through didactic presentations and multidisciplinary case-based learning. And some of the hallmarks of ECHO include free continuing education credits, hour-long sessions held most often monthly or bi-monthly, but there is some wiggle room. And there are de-identified case presentations from a learning community followed by case discussion. And so if you've been to an ECHO, you'll have a very strong sense and feel for the format. ECHOs are very structured. If you've been to one, you probably really kind of understand. They don't deviate a whole lot in terms of the way that they look. And that can be really helpful so that folks, when they come in, they know what to expect. The routine and structure of ECHO is very sound and very tried in terms of its efficacy with providers. And so as you can see here, when it comes to, well, where are the pictures? Hold on. Okay, there you go. I was like, as you can see here, there's a lot of variety when it comes to ECHO. And so the RTTC has worked with a variety of groups. ECHOs can be disease specific. So here you see some disease specific ECHOs such as HIV. One was offered in English, one was offered in Spanish. But they can also be more generalized. For a while, we were working on one that focused on early career professionals, where they would come together and talk about advice, share insights with one another, provide support. It was meant to be a place of empowerment for young professionals that were kind of just starting their career. And that was more disease agnostic. All right, so we'll take a little bit deeper of a dive. So one of the learning partners that we worked with on ECHO came to us from the Clinical Education Initiative, or CEI for short. This group had an established ECHO learning series. So like I mentioned, sometimes people come to us and they're not sure where to start. And so we start from scratch with setting up a telementoring model, but sometimes folks come to us and they already have one in place. And so CEI did already have an ECHO learning series that had been established. It also happened to be in the HIV space. And for them, their challenge was reaching rural providers in upstate New York. So together, the RTTC and CEI worked to expand their ECHO by assessing current communication strategies. So we looked at what they were currently doing and then opportunities that they were potentially missing. We discussed and helped them think through and work through conducting a landscape analysis of missed marketing opportunities. We expanded evaluation strategies and identified possible barriers for rural providers unable to join their current standing ECHO series. And then we identified areas for change to make the ECHO more enticing for rural providers in upstate New York. And so through this collaboration, CEI was able to enhance their marketing, and with a few adjustments to their ECHO, they were able to successfully increase the number of participating rural providers in upstate New York. All right, so on to the next telementoring model that is similar to Project ECHO, but less hierarchical, and that is adapted community health clubs. And these health clubs were originally designated as community-based health education and behavior change programs in sub-Saharan Africa to educate communities on water sanitation and hygiene. And for RTTC, we adapted this model to create virtual places instead of its original format, which was in person, where groups of healthcare workers can participate in peer-to-peer mentoring, training, and social support that addresses and adapts to group identified needs to build competencies and to discuss healthcare issues. And so there's a lot of flexibility to this model, but some of the overarching themes would be a lot of adaptive community health clubs have 8 sessions at regular intervals. So you can kind of think of like a cohort style. They do have didactic presentations similar to ECHO, but if you notice in the definition, adaptive community health clubs are peer-to-peer versus ECHO has that subject matter that's kind of working with a group of people that are coming together. And so this is more peer focused. So everybody that joins an adaptive community health club is seen as their own kind of subject matter expert in their own regard, and they're bringing that knowledge together to share that knowledge. So there's that interactive peer facilitated discussions and collaboration. Folks engage in participatory learning activities. And one of the unique things about adaptive community health clubs is they create what we call a product that'll be shared within the group. And sometimes it goes beyond the group. And so that last point is really what makes adaptive community health clubs unique. It's the group's creation of an end product. And so end products can range from a membership card, which you can see here that just popped up. This came out of one of our learning partners in South Texas. We worked with a group of AETCs in South Texas, and they came together to help us pilot this model. And they decided their product would be like a membership card. And so you would see it on their screens as they worked together. They came together to design it. But the products can also be more robust. And we're going to take a closer look here in just a moment. Such as a resource library, which our Oklahoma State University learning partner is working on with their community health worker students. So let's take a deeper dive into this one. So OSU's Adaptive Community Health Club was focused on gathering local resources pertinent to community health workers. So we were outreached by the university. They said, hey, we have this community health worker program. We have a lot of students. We see a lot of utility with the adaptive community health clubs. We think this could be a really great model to help strengthen some of the programming activities that the university is doing with students in their classes. And so each community health worker student in the club was assigned a county to research local resources. This initiative was driven by OSU's AHEC program. So you can see how the AHECs are broken up across the state of Oklahoma. If you look closely, you can see the little counties that were in there. And so students would come together, and then in the Adaptive Community Health Club, they would bring the resources that they researched, and then students would gather the materials, share them with one another. They work together to organize the information, provide feedback, and discuss like how to make this resource library more useful, not only to students, but folks in the community, and how they might disperse it beyond just their small group to other community health workers still working out in the field that have perhaps already graduated or established. And so you can see a testimonial here on the left-hand side of one of the participants of the Adaptive Community Health Club. All right, so our next model is very familiar to you all. It is webinars, and it's probably safe to assume you all know what this is, but I'm going to go ahead and still define it to make sure we're all on the same page. So webinars are defined as live audiovisual presentations delivered by an individual or panel with a discussion and interactive question and answer component. So one of our very first learning partners that came to RTTC for technical assistance came from the South Texas Oral Health Network, and they were looking for ideas to enhance their webinar to make it more attractive to learners. So they also already had an established model up and running. And so for this partner, they had their established webinar series that was geared toward dental practitioners and community members participating in a practice-based research network within South Texas. And their goal was to increase webinar session interactivity. So how do they make their webinar more engaging? They were focused on describing the origins of e-cigarettes, their risks, and strategies for smoking cessation. And so with this learning partner, we worked on supporting marketing, communications, evaluation, session design, and how to offer continuing education credits to make that webinar series more attractive. After they worked with RTTC, the South Texas Oral Health Network was able to effectively enhance their webinar series, and they even wrote an article that they submitted for publication, and it was accepted and published in a Texas dental journal, which is pretty exciting. So our second to last model, so we're getting there. So thank you all for hanging in there, is online modules and curricula. I think another interchangeable word as e-learning. That's the same thing. And so for this model, we are discussing or thinking about self-paced learning via online modules that have slides that may or may not have audio. So it's really getting at the asynchronous learning. And for this telementoring request example that I want to share with you, we were outreached by the Montana Department of Public Health and Human Services, and they had been working with their area health education center, so their AHEC, lots of AHECs when it comes to RTTC, and the health department was working with the Office of Rural Health that was working with their affiliate AHEC to assist with the creation of 3 online courses focused on asthma and wildfire smoke for mid-level medical professionals. In addition, when the health department completed the creation of the online courses, the larger vision was for those courses to become a part of Montana State University's community health worker course curriculum. Montana doesn't currently have a credentialing process for community health workers like some states do. If you've noticed, we talk a lot about Texas. That's because Steven and I sit out of Texas. So a lot of our partners and our knowledge base comes from Texas. And so while Texas has a very strong community health worker program, Montana is still in its journey. And so the thought was if they can start to build out for curriculum, they can embed that in Montana State University's programs for people that are studying to become community health workers. And so for this learning partner, we assisted with working through course layout and design, how to write learning objectives using Bloom's taxonomy. We discussed the importance of storyboarding, and we assisted with creating storyboarding templates to help with the construction and design of the courses. We discussed the importance of checking for knowledge transfer from the course to the learner and how we might do that. Do we want to embed knowledge checks throughout the course? Do we want to do a pre-post test only? Do we want to do both? And then we'd also discussed, well, once the courses are developed, where are they going to live? And so the answer is a learning management system. And so we discussed where they might access learning management system. It might be multiple, and how those courses might look like, since no 2 learning management systems are created the same. So there's always considerations with online modules and curricula, how you load those in. So I think we can go to the next slide, maybe. Yeah, okay. So during this partnership, we were able to connect the Montana Department of Public Health and Human Services with Texas's South Central AETC. So we did some cross-pollination. So it just so happened down here in Texas, asthma and wildfire smoke are also issues that our state experiences, as well as Montana. And so we made this link, and out of that connection, the South Central AETC was able to assist with creating some short educational videos related to asthma. So 3 videos were produced. They identified asthma triggers in different settings to help improve asthma outcomes. We can check out an abbreviated clip in just a moment. All of these clips were with actors here in Texas, scripts were written, and all of this was done in partnership with Montana so that these videos could be used for both sets of folks. And so we can take a quick look at a snippet of one of the videos that came out of this partnership through RTTC. If it wants to play.
Hello, thank you for calling. This is Sandra.
Hi Sandra, this is Alicia. I'm the school nurse over here at Margot High. I was calling about possibly scheduling a home visit. It's one of our students. His name is Sam. He's a freshman.
Okay, sure. What's going on with Sam?
Yeah, Sam has come into my office every now and then with coughing and wheezing. I typically just set him down and then I'm able to send him back to class. But for the past couple of weeks, his coughing and wheezing has been so bad that I actually have to send him home. In this past month alone, he's been absent 5 days.
Poor thing. I think a home health visit would be helpful to better understand what's causing his symptoms to get worse. If I can get that contact information, I'll schedule it right away.
Okay, great. Yeah, I can get his contact information and his address, and I'll send that right over.
Okay, thank you.
Great. Okay. So then that brings us to our last telementoring model. So hopefully y'all enjoyed that example. And so of course that video, well, the longer video was embedded in the courses. And so it's a really great collaboration with Montana. But speaking of Montana, our last example is going to be a podcast. And so our podcast partner also happened to come from the Montana Department of Public Health and Human Services, different area. And they were focused on reaching rural Montanans and Montana healthcare workers. When we're talking about podcasts, we're talking about audio or audio with visual enhancements, and they're broadcasts that are distributed through the internet and can be consumed via platforms such as web pages and handheld devices. And Montana felt this would be really helpful because they have such rural communities within Montana that getting information out can be really difficult. They had tried other ways to push out information on health topics, and they weren't having a lot of success. And so Montana's vision was to try a different platform, specifically podcasts, to host interviews where the health department would be the subject matter expert. And then they would do the interview. It would be across a range of healthcare topics. And then they would share these stories out, and they would share out associated resources across the state so that it would hopefully reach a variety of Montanans that were looking for information or wanting to access additional resources to healthcare. But instead of me getting into like the details, there's a really great clip that we have from our partner. Her name is Jennifer Van Sickle, and she'll talk to you a little bit more about the podcast they created, Talking Health in the 406.
Hi, everybody. My name is Jennifer Van Sickle, and I am a Quality Improvement Coordinator and Health Education Specialist at the Montana Department of Public Health and Human Services. And I want to visit with you about our work with RTTC to develop a podcast to impact and educate our population in Montana. So to start with Montana, we are an incredible, diverse state. We have just over 1 million residents, and together we're spread over 147,000 square miles. I'm proud to say we have the second largest veterans population in the United States, but unfortunately we are low income. We're number 11 from the bottom. We're a population of tough yet caring, independent individuals. We're a state of extremes in so many ways. From farmers and ranchers, miners, to software developers and those that make their income off the tourism industry, thanks to Yellowstone and Glacier National Parks and our other natural wonders. We also hold the record for temperature extremes, swinging 103 degrees in 24 hours, which is not only a US record, but an unofficial world record. So with all these extremes over all this land, Montana poses a very unique challenge to those of us at the Department of Public Health and Human Services. Just to put it into perspective, if you were to drive from the northwest corner of the state, Yaak, Montana, to Alzada, which is in the southeastern corner of the state, you're pretty much looking at the same distance as driving from New York to Chicago. It's big. So at the Montana Department of Public Health and Human Services, we have subject matter experts, we have data, we have analysis, we have reports, we have fact sheets. We have so much great information to get out there to our residents' hands to help them, to educate, to inform. But our data, our information, it looks like this. You know, how do we reach people? Well, we've tried social media. We have a Facebook page that's been open since 2018. And we've managed to get about 4,000 people that follow us on there. We did start Instagram in 2019, and we're up to about 650 followers on there. But out of 1 million people, is that enough? Are we really just hitting a drop in the bucket? And we all know people who aren't on social media, who don't touch the thing. So how are we going to get all of this great information to the people who are here? How do we do that? Well, I'll tell you what. We asked them. We didn't do an official mailing or an official telephone poll. Team members who work here travel the state frequently. So in the East, we asked the wheat farmers, what do you do all day when you're in the tractor? In the West, we asked the ranchers, what do you do all night when you're sitting there waiting for that cow to have her calf? We asked the average Montanan who has 9 to 5 commute, what do you do? What do you do when you're sitting in the car driving to work? And the answer was similar throughout. Podcasts. Podcasts are perfect. They're portable. So that farmer who's going to be out spending all day in the fields from dawn till dusk can download enough podcasts to his or her device to last all day, because that person probably does not have a radio signal and they probably don't have cell service. They're conversational. So when that tired rancher is up all night, instead of feeling like he or she is being lectured to, they can listen to an interesting conversation that they can relate to and they can understand and they can be entertained by. They're also adaptable for literacy. We can discuss and explain tough topics, hard to understand subjects, where the average person is not going to go open a book and read a research document on that subject. We can have a conversation around that subject and give the audience a much more full, richer understanding of the content. We couldn't have done it without RTTC. Thanks to them, we received the guidance on where to even begin with podcasting. We also received the confidence that yes, you guys can do this. You can get this podcast together and reach your audience. We received technical expertise on equipment, microphones, software. What do we edit the podcast with? Research assistants. They helped find information we could not. So we knew which direction to steer our podcast and our podcast creations and game plan. They also did check-ins. And with those check-ins, they gave us the drive to keep moving forward and make this happen.
So it's always nice to hear from Jennifer herself. And since launching their podcast, Talking Health in the 406, Montana has released over 34 episodes to date. And they have also been invited to a public health conference roundtable. They've received local news interviews, and they had a press release on their podcast, and their podcast is still in existence. It's up and running, and they continue to release new episodes. So that's pretty exciting. So with that, I will pass it back and say thank you all.
Thank you, Laura. And I do want to mention that we will be featuring 2 new telementoring models that are in development, virtual preceptorships and virtual unconference. So we will be adding that to the support, the telementoring model support that we provide through the RTTC. And now I will be, my name is Tricia Melito. I'm the evaluation lead, and I will be speaking about ways to evaluate a telementoring program. We have the Telementoring Quality Measure Toolkit, which is designed to help implementation teams build, sustain, maintain their telementoring programs by helping them to identify telementoring model program strengths and areas for improvement. In the next slide, you'll see that the evidence-based toolkit was developed through multiple steps. We started out with a literature review to see what was published in terms of evaluation of telementoring models. Then we did interviews with people who have experience in implementing these models to confirm and expand on any additional evaluation quality measures. And then finally, we held several consensus committees to determine if the quality measures were feasible and useful to evaluate a telementoring program. And the end result, you'll see in the next slide, was compiled into the toolkit, which includes an introduction, instructions for use, and the actual quality measures for evaluating telementoring models in easy-to-use checklist. And then we also have 2 supporting appendices. In the next slide, you'll see that for using the toolkit, we propose the Plan, Do, Check, Act model, whereby the implementation team uses the toolkit multiple times during implementation to assess their model, the model strengths, and then also identify potential areas for improvement. The toolkit, in the next slide, you'll see that the toolkit checklist addressed several domains to evaluate models. These include staffing, the content of the model, technology, the learner, marketing, sustainability, the instructor, and impact. And then in the next slide, you'll actually see a sample checklist for evaluating webinar content. These 3 questions included evidence-based evaluation measures. And after going through this list, a score is calculated based on the score, the implementation team can decide if there are any adjustments that they want to make in the domain of content for their webinar. So this checklist is just one small part of the larger checklist for evaluating a webinar. We do have the toolkit available on an app, which not only includes the toolkit, but also descriptions of the telemetry models and our training and technical assistance pathway, which Suyen will be discussing. And now I will turn it back over to Suyen.
Thanks, Trisha. So after hearing all of this information, you all might still be thinking about how you can utilize telementoring. You might wonder, what's the best way to reach our learners, or what's the best telementoring model for us to use? Or as Trisha just mentioned, how can we assess the quality of an existing program? And well, here at the RTTC, we provide free tools and training and assistance to help these organizations accomplish their goals and meet the need of their learners. And we have various tools and trainings. For instance, we have online courses for each of the models, which also include learning kits. And these vary depending on the model. As you all heard from Jennifer Vansickle, since they were working on a podcast, it could look, like such as hardware or software to utilize, editing, which microphone would work best. So depending on the model, you'll have various learning kits. We also offer live trainings for organizations that are interested in creating an echo, and we have a 1.5-day training for those who are interested in launching a virtual adapted community health club. And as Trisha mentioned, we have our telementoring quality measure toolkit for those who have an existing model. So now that you all have heard about our tools and trainings, you might wonder where you can access them. Well, there's actually 2 avenues where our learning partners can access our tools and trainings. So the first one lies within our course catalog. As I mentioned, we have courses that we've developed for our 6 models, which we are actually currently revamping, and they will launch next month. And it'll include an overview of the model, considerations to think about as you choose the model that is the best fit for your needs. And it will have, learning kits such as checklists or timelines or recommended items. And then the second option is to directly submit a training and technical assistance form online. So who can participate? Well, any program, not necessarily the organization, but any program that has a rural footprint can reach out to the RTTC. And as Laura mentioned, our services are disease agnostic, and they all are provided at no cost. And we help folks with various topics. For instance, some examples are, foster care. UT Health San Antonio received a $4 million grant to create training for nurses, and we're currently helping them do an e-learning course, which eventually they will turn into an ECHO program. We've also helped other organizations create podcasts over Chagas, different infectious diseases, or also autism. And then the $1 million question, how can you become a learning partner with the RTTC? Well, it's actually quite simple and only consists of 3 steps. So the first one, as I mentioned, is to submit the training and technical assistance request form, and I'll go into detail on how to do this on the next slide. The second step is to complete our needs and readiness assessment, and this assessment is also helpful for our team to learn a bit more about the Learning Partners program, and it helps us prepare for the next step, which is the discovery phase. And this is when the learning partner begins to meet with us, and we can begin discussing their telementoring program and figure out the next steps. So step 1, as I mentioned, is submitting the training and technical assistance form online. And you can do this in 2 ways. The first one is visiting our website. and clicking on our Tools and Training tab, and the second lies within our telementoring courses as well. And so step 2 is completing the needs and readiness assessment. So for the TTA arm of this program, we utilized a systems approach when developing and designing our trainings. Specifically, we utilized the instructional design model called ADDIE, which stands for Analyze, Design, Develop, Implement, and Evaluate. So the first step, beginning with A, so analyzing the needs of our learning partners. So with this in mind, we created the needs and readiness assessment to learn a bit more about our learning partners. And it also helps them, think about their programs, such as like, what is the healthcare gap that you're hoping to close in your community? Or who is your target audience for your program? Or what existing resources, be it personnel or hardware, do you have in place to assist as you're building and sustaining this program as well? And step 3 here, I just wanted to share with you all our structured TTA workflow. Just to let you all know that we're always here to help our learning partners, be it from creating a work plan or brainstorming on ideas to having continuous meetings, because we do know this is an iterative process. I mean, there's learning partners that we've worked with for, a few months, and then there's some that we've worked with for a few years. And then finally, it's getting them ready and prepared to launch their telementoring model. However, once their model has launched, we're always here to help. So we always reach out 1 month or 3 month post-launch just to check in to see how things are going and let our learning partners know that we're always here to provide them with any additional support if needed. And then lastly, I just wanted to share with you all, we have another annual event that we host each year. They're normally around October, but it's our Rural Telementoring Unconference. So for those of you that may not be familiar with an unconference, it is a meeting format that sheds the structure of a traditional conference, and it emphasizes more the participant-driven collaboration. And it consists of what we call 4x4s. So the presenters can only utilize 4 slides and 4 minutes to speak on their topic. And then we normally have 8 breakout sessions that provide attendees with that interactive and unique approach, so they are able to discuss their experiences, hopefully identify areas of potential collaboration, and then, just making those connections. And that is one of the main key things of our unconference is, a lot of folks feel isolated, like they're the only ones experiencing this. But during an unconference, you're able to meet other folks as well. And I just wanted to share with y'all a brief video. So this was from our second one, and the theme was technology as a catalyst for change. And this is John McKenzie. He's the Executive Director of the Division of Academic Innovations at the Health Science Center in Fort Worth.
Finally, and this is my favorite to share with you because it gets a little bit speculative and it's really talking about the near future rather than today, is the use of AI to serve as a medically trained companion. I think about companionship primarily as a form of care in 2 different settings. I'm sure there are others as well that you could think about as well. I'm thinking about nursing home and hospice care, and I'm thinking about children's hospitals where families can't be available 24/7 to provide that kind of companionship, but it's nonetheless critically important for those patients. What you see on the screen here is Keanu Reeves. He's not my friend. He's not my neighbor. He's not my relative. He's not my cousin. He didn't pose for these photos for me. These are AI generated photos. I just asked for images of Keanu Reeves dressed as a hospice nurse, and this is what it gave me. The technology exists today to create live video as well. You combine that with large language models like ChatGPT, and you combine it with voice emulation technology, and you get to something very interesting. The first person to do this is going to make $1 billion by making a business out of it. If Keanu Reeves isn't your favorite, then maybe it's Meryl Streep. You can see here, it looks like Meryl Streep, but something's a little bit off. The technology will get there. Give it time. My personal choice would have been Patrick Stewart, Captain Jean-Luc Picard himself. He's who I wanted to be my hospice provider. So take just a moment and listen.
How are you feeling today, Mr. McKenzie? Is there anything I can help you with?
What you just heard was actually my voice modulated to sound like Patrick Stewart's. That's not even necessary. There's other tools that you can type in text. It'll give you the voice. Other tools like ChatGPT that'll actually generate what it has to say and use that voice. That's where I think we're going in the near future. Thanks for having me today. It's been my pleasure.
So just to recap, these are our program goals. So number one, delivering nationwide training and technical assistance to academic medical centers and other centers of excellence on telementoring models. Goal number two, promoting best practices for these telementoring models to increase the viability in rural areas. Number three, utilizing the RTTC infrastructure to support evaluation of rural health, for instance, with the use of our telementoring program, our quality telementoring toolkit. And then lastly, what we're doing here today, which is disseminating information about our telementoring programs, materials, and resources. So thank you very much for being here today with us. And then here are our social media accounts in case you all would be interested in staying up to date of our events and resources. Thank you.
Thank you very much for presenting today. We did have a hand raised during the presentation, so I wanted to give Diana a chance to ask their question if they would like.
Sorry, I hit the wrong button. Didn't realize it was raised a while ago. Thank you.
Oh, thank you. Okay. Were there any questions for our presenters today while we have a few minutes left? I think there are some great resources, and I'll be putting some more things in the chat as we close out. If you do have a question, you can still put it in the chat and we will provide it as part of our follow-up. I'll turn it back over to Haley. Thank you so much to Suyan, Laura, and Tricia for joining us today and providing great information and resources for our audience. I did quickly just want to mention that we do have an upcoming HTRC education series session on January 28th. Rochelle Marding, our licensure and policy partner, is going to discuss the 2025 telehealth landscape, including critical Medicare billing and policy updates. So we hope to see you all there. As Dr. Brown mentioned, if you do have any questions, feel free to email them to us at htrc@kumc.edu. And if you'd like a certificate of attendance, you can request it there with your full name. So thank you all so much for joining. We hope to see you next time.